Hey everybody, this is Dr. Greg Barnes, and I'm with Triangle Health Center. Our office is located on the corner of Chapel Hill Road and Northwest Cary Parkway. We've been taking care of patients for over 10 years there. And today I'm going to be sharing with you, I'm going to be doing an adjustment on one of my patients, Amanda. And Amanda has a job where she's looking down a lot. So in our world, and in the medical and chiropractic world, we call that text neck, although it can involve a variety of things. So what I'm going to do is I'm going to show you today how we adjust someone with text neck and kind of what kind of issues that commonly causes for people. But I think one of the main things that we see a lot with text neck and the issues that cause is that it's something that we get so used to doing. We get so used to being in a position where we're looking down, all day long with our job, maybe on our phones or our computers or other things that we might be doing. And we kind of start getting used to the muscle tension that creates, or the headaches that creates, or even the neck pain itself. And sometimes if it really starts progressing a lot further, you can start seeing things get into the shoulder, even going down the arms and into the hands and fingers. So I'm going to be walking you through how I adjust someone like Amanda with that. So you can go ahead and lay face down for me. In our treatment rooms, we have x-rays that we pull up for all of our patients. So that's how we really identify the cause of what's going on with that. So one of the things with Amanda's neck is that it is forward, like most people that we see, again, because of the world that we live in. So we're gonna be doing some specific adjustments to help address that. And with her particularly, how it most commonly affects her is that she starts getting this kind of issue down into her shoulder blade, sometimes across the top, a little bit of stiffness in the neck, but it kind of mostly manifests kind of lower there. That just means it's starting to pull on what's going on through that. So then we do what's called palpation. So we start feeling in to get, really hone in where we need to go. So you feel that right there? Mm-hmm. Yep. So we're gonna do a correction and do an adjustment right on that spot. So breath in, all the way out. Awesome, and that moved really good. Also, for these patients too, find there's, like I said, a lot of muscle tension. So we'll use one of these massage guns to help loosen things up a little bit as well. So I'm going to do it fast just for the sake of the video here, but normally we'd just spend absolutely as much time as we would need to do to loosen this thing up. A lot of people say it hurts good, or just feels really good in general. Good. All right, turn over on your back for me. So now we're going to do an adjustment on the neck. I'm going to show two different ways to do it. Amanda is one of those patients that likes the normal kind of manual style that we call it, or hands-on approach for the adjustment of the neck. So I'm going to do that, and then I'll show another way that we do it as well. So turn your head like this. Nice gentle impulse here. Great. Another one here. Big stretch here as well. Good. All right, go sit up. So what we're doing with that adjustment there, we're helping to, as those joints take a lot of stress and pressure from that downward position all day long, it starts to really compact things, causes the muscles to tense up, and then it also puts pressure on the nerves as well, which can then lead to, again, those symptoms like I mentioned before. So a really specific adjustment like we just did on that goes a long way to helping to correct that and improve that. So for people that don't like to get their necks adjusted with kind of the hands-on style, we have lots of other tools and ways to do that. One of them is with the ArthroStim here. So this is an impulse tool that kind of sounds like a little machine gun, but it really just helps to do very specific corrections on the spine. We also use it because it's a really good postural correction device too. So we do this right in the back of the neck here. As you see, I'm bringing her neck into kind of an exaggerated extension or lifting to help really improve that posture. Beautiful. So it sounds kind of crazy, but it actually feels really good there too. And then in her case, we always got the shoulder that we got to work on too. So we're going to get that as well. Just make sure it's good. Yep, and it was actually pretty good. So cool. All right, so that's an adjustment similar to what we do. Of course, everybody's unique, but how we would sort of address the unique situations with text neck. All right, so that's how we address text neck, or, and every patient's unique, of course. That's kind of an example of how we would adjust someone that's having issues related to that. Please comment on this video and like it, or click the link on the video if you want to learn more about that. Or you can call our office at 919-469-0900. Thanks for watching, and we look forward to seeing you on the next video.